My name is Nangu, and today I'm going to talk about hospital-acquired infections. Hospital-acquired infection is one of the most common complications of hospital care, and is one of the top 10 leading causes of death in the world. Firstly, I will introduce how infection is transmitted. Then I will discuss the impact of hospital-acquired infection in hospital. I will also introduce the infection control policy and strategies that nurses should comply with to reduce the risk of having hospital-acquired infections. Lastly, I will summarize what have been discussed in this presentation. So, how infection is transmitted? There are three main routes of transmission: contact transmission, droplet transmission, and airborne transmission. Contact transmission includes direct contact transmission and indirect transmission. Direct contact transmission involves a direct body surface contact of virus or bacteria between a susceptible host and an infected person. This commonly happens between patient and nurse, such as when nurses perform personal care that require direct personal contact. It also commonly happens between two patients, such as shake hands. Indirect contact transmission involves contact of a susceptible host with a contaminated object, such as contaminated needles, contaminated gloves that are not changed between patients. Droplet transmission occurs when contaminated droplets from the infected patients are propelled a short distance through the air and dropped on the susceptible person's body. It usually is transmitted by coughing, sneezing, and talking. Airborne transmission, which means the contaminated dust particle that can remain suspended in the air for a long period of time. The contaminated air may be inhaled by a susceptible person over a long distance from the infected patient. Then let's have a look at the impact of hospital-acquired infections. According to research, large amount of Australian hospital patients experience hospital-acquired infections each year. From 2015 to 2016, over 6,000 of hospital-acquired infections are diagnosed in Australian hospitals, which is 1 in every 74 patients. Hospital-acquired infections result in a prolonged hospital stay, which is approximately 18.1 days longer than patients without this complication. And longer hospital stay would associate with higher cost. It also results in increased morbidity and mortality, as well as the risk of readmission within a year. From 2015 to 2016, hospital-acquired urine tract infection accounted for 26.6% of all hospital-acquired infections, which is the most common hospital-acquired infections. It shows a patient with hospital-acquired UTI will have 20.6 days longer hospital stay than a patient without this infection. In 2015, over 17,000 of hospital-acquired pneumonia has diagnosis in Australian public hospital. Infection of surgical sites happens in about 3% of surgical procedures. In 2015, over 5,000 patients have experienced hospital-acquired surgical site infection. There was more than 15,000 of hospital-acquired bloodstream infection in 2015, and according to research, having bloodstream infection is 2 to 3 times more likely to die than those without this infection. Also, patients' mortality rate is 3 times greater if they have hospital-acquired bloodstream infection. Hospital-acquired infection has great impact on healthy workplace and patient safety. It causes patient pain, suffering, and even death, and use up valuable healthcare resources. However, more than half of hospital-acquired infections can be avoided. Now, let's talk about what nurses should do to prevent this happening. Just as there are multiple causes of hospital-acquired infection, there are many strategies to address this problem. Effective infection control requires a range of initiatives at different levels. New South Wales Public Health Organisation have published the mandatory requirements and the governance structure for health professionals. All healthcare professionals must comply with relevant regulation and policy in order to ensure patient safety and maintain healthy workplace. Health practitioner regulation has mentioned that health practitioners must comply with the infection control standards, which focus on hand hygiene, use of personal protective equipment, and waste management. Hand wash should be performed before and after any direct patient care and immediately after contact with body fluid, and before and after performing a procedure. Hand wash should be performed regardless of whether gloves are worn. Protective personal equipment includes gloves, gum, mask, and protective eyewear should be worn if there's a possibility of being contaminated with body fluid. In addition, it should be discarded after use. Clinical waste should be packaged properly to prevent potential exposure to infection. Sharps, such as needle, scalpel, or other sharp instruments, should be discarded in a sharp bin immediately after use. According to Code of Conduct, nurses have responsibility to ensure policy, procedure, and protocols are implemented. For example, nurse should make sure infectious patients is isolated, and appropriate format for prevention plans are implemented. Nurses should also ensure the families, carriers, and visitors have access to hand hygiene products and PPE to enable them protect themselves. Nurses are required to keep themselves, co-workers, and patients in a safe and healthy environment. Therefore, it is a responsibility for all nurses to teach, supervise, and assess students and other nurses to making sure the highest infection control standards are performed across the profession. In teaching and assessing the competence and performance of co-worker or students, nurses should be objective, honest, and constructive, and provide accurate information. Besides, nurses should develop a partnership with patients and take a leadership position in developing a hospital-acquired infection management plan. Nurses should inform patients about the purpose and process of developing a hospital-acquired infection management plan and invite them to be involved in this development. It's nurses' responsibility to improve their awareness of hospital-acquired infection, provide information for patients, carers, and families about prevention of hospital-acquired infection, such as teach patients about standard precautions, proper hand hygiene, and how to utilize appropriate personal protective equipment. This presentation has talked about how hospital-acquired infection is transmitted. Then it discussed the impact of hospital-acquired infections. It will prolong the hospital stay, increase mortality and morbidity rate, and increase healthcare cost. After that, it introduced the infection control policy and strategies that nurses should comply with to prevent hospital-acquired infection and in order to ensure patient safety and build up a healthy workplace. The policy includes perform proper hand wash, use PPE, teach and assess co-workers practice and educate patients about infection control preventions. This presentation is aiming to improve nurses' awareness of hospital-acquired infection. Not only nurses themselves should maintain a high standard practice, but also it's important to assess students and co-workers to provide safe care. It's also important to develop a partnership with patients and teach them about infection prevention. Infection control is crucial to reduce the risk of getting hospital-acquired infection. And as a registered nurse, it's our responsibility to ensure all preventions are implemented. Thank you so much for listening. And here is the reference list.